Lexington has outbreak of whooping cough, which can be deadly for babies and prevented with vaccine that some adults need too. An outbreak of whooping cough has been declared in Fayette County after 9 cases have been confirmed by the local health department since late April. Whooping cough, known medically as pertussis, is a highly contagious respiratory illness spread by coughing and sneezing. It affects people of all ages but can be most serious in infants, young children, and those with chronic diseases. The disease is largely preventable by vaccination, but vaccination rates for pertussis and other diseases prevalent in childhood have been declining. All Central Kentucky caregivers should be on the lookout for signs and symptoms of pertussis or whooping cough while ensuring their kids are up to date on their vaccines or fully vaccinated with the booster, the Lexington-Fayette County Health Department said in a news release. The latest Fayette County cases include one at Lafayette High School, one at St. Peter and Paul Catholic School, and a community case involving a person in their 80s, according to the release. Dr. Sean M. McTeague, Medical Director for Pediatric Infection Prevention and Control at Kentucky Children's Hospital, said symptoms of pertussis in children, adolescents, and adults first look like an upper respiratory infection, including nasal congestion, runny nose, and possible fever, and then lead to a very intense and prolonged cough. The cough is characterized by prolonged coughing fits that typically end with a loud whoop when catching breath afterwards, he said. These coughing spells can be so intense that a patient may fracture ribs or rupture blood vessels in the eyes. The early symptoms of whooping cough can last for 1 to 2 weeks, and the coughing fits usually last 1 to 6 weeks, but can last for up to 10 weeks, according to the Centers for Disease Control and Prevention. People are contagious from the start of symptoms and for at least 2 weeks after the coughing begins, says the CDC. Any school-age children with symptoms of pertussis should stay home from school and visit their healthcare provider for evaluation, even if they have previously been vaccinated, said the release. Some adults need vaccine boosters. While most of the Fayette County cases have been seen in adolescents, McTeague said, pertussis is more dangerous to young infants. In young infants, pertussis more often presents with apnea, a sleep disorder, he said. This means that the infant stops breathing for a period of time. This can be long enough to cause severe damage or death if not noticed promptly. For this reason, it is extremely important that all infants be vaccinated against pertussis. Between 2010 and 2020, the CDC reports up to 20 babies died from pertussis each year in the United States. It's recommended that pregnant women should get a single dose of the pertussis vaccine during every pregnancy, preferably at 27 through 36 weeks. Being vaccinated during pregnancy will allow the mother to pass antibodies along to the infant prior to delivery as another key part of prevention for the most vulnerable, said McTeague. He added that it is also important for anyone in contact with infants to get a booster of the combined tetanus diphtheria pertussis vaccine, known as Tdap. Because vaccination does not start until 2 months of life and is not completed until later, the best prevention also includes all contacts being vaccinated as well, he said. This includes booster vaccines given every 10 years as Tdap, which has replaced the tetanus booster. The best way to prevent whooping cough is through vaccination. The childhood vaccine is called DTaP. Infants should receive a series of DTaP immunizations at 2, 4, and 6 months, with boosters at 15, 18 months, and 4, 6 years. Children should then get a single dose of Tdap vaccine at 11 or 12. Boosters are required every 10 years to maintain efficacy. Achieving immunization rates greater than 95% is desirable to prevent the active transmission of vaccine-preventable diseases, Bryce Mitchell, spokesman for the Cabinet for Health and Family Services, said in an